Welcome to Staying Connected, a podcast where I talk to people about their stories with VEDS, Marfan, Loeys-Dietz, and related vascular and aortic connective tissue conditions. The views, information, and opinions in this podcast are those of the individuals involved, and the information presented does not constitute medical or other professional advice or services. Welcome back. Today we're going to talk to Bella Marin, who was previously on the show to talk about her story with VEDS or Vascular Ehlers-Danlos syndrome. In today's episode, she's returning to the show to talk about her recent experience with the bowel perforation and resulting complications. Quick note, in this episode, Bella will share in depth her experiences with the bowel perforation, surgery, fistula, and more. Some of this information is graphic, so please listen with care. Before we jump into the interview, if you like this podcast and you want to support our community in our efforts to raise awareness through this show, you can buy merch at my Printify pop-up store, make a one-time donation, or support the show by joining my Patreon. This show wouldn't be possible without the continued support of my Patreon subscribers and donors, so if you've already been supporting the show, thank you. Check out the episode show notes for links to ways to support the show. Let's get into the interview with Bella. Hey, Bella, thank you so much for coming back onto the podcast to talk about your recent bowel perforation with Vascular Ehlers-Danlos syndrome. For anybody who doesn't know Bella was on the show back in 2019, I think it was. And you were our 14th episode of Staying Connected. And I'm so
long ago.
Yes.
I can't even remember, but it does feel good to be back.
Yeah.
A lot has happened since then for the both of us. Mm-hmm. For sure.
Around the same time last year. We're both as we're recording this, it's like the beginning of November when we're recording this, and it's been almost a year for mine, which means it's been almost a year for yours.
Yep. Yeah. Anniversaries.
Happy anniversary. So for people who don't know you, who have not listened to your story back in 2019 or have not had the pleasure of meeting you in person or watching any of your are they reels, TikToks, I feel like you're everywhere in this space. For people who have not been introduced to you before, do you want to introduce yourself?
Yeah, my little elevator speech. So, as we know, I'm Bella, and I was diagnosed with VEDS when I was 10, and this was back in 2004. I'm the first one in my family to have it, so all my family members tested negative. I was diagnosed just because of my mom's intuition to keep looking into answers for why I, had thin skin, would cut easily, would bruise easily without any trauma. And then I did fairly well throughout my teenage years. I did have a left vertebral artery dissection when I was 16 or 17 that I did not have to have any surgery for. I didn't even know I had it until it came up on subsequent scans. My first major event was a bowel obstruction in the small bowel, which I had to have emergency surgery for at 18. And then I had another bowel obstruction about 8 months later where that was caused by scar tissue from the first surgery. And then after that, the main complication for me was my calf muscle that would recurrently tear, heals and tears over and over. And then it was in 2018, my colon perforated for the first time. And I was able to go without surgery. It healed on its own. It wasn't easy, but easy compared to what happened to me last year. And then last year, my colon perforated for the second time. So that's kind of a nutshell of the major events that I've been through. My VEDS resume, if you will.
VEDS resume. If you want to go back and listen to Bella's story that she told in 2019 of those initial, the diagnosis and the complications that she went through before that time, definitely check it out. It's in season 1. But we'll keep it there for this episode and dive into your colon perforation last year. So obviously this was, as you mentioned, a much different experience than your last colon perforation. How
Yeah.
did this start? Like, what were the symptoms like? Like, walk us through this.
So it just happened out of nowhere. But I will say that when my colon perforated for the first time, which was in 2018, I did have a bad year with my intestines. Like I, suffered from a lot of constipation. I was hospitalized one other time before it. I was seeing a GI doctor to get a workup, but the perforation happened spontaneously, right? Like I got this severe pain out of nowhere. And it was similar with this perforation from last year. So in January of 2023, I started my year off in the hospital with some intestine inflammation. And then I got COVID in the summer of 2023. My calf muscle tore again. I was immobile, and it kind of just started going downhill from there. And then it was in November of last year. I just remember it being a period of high stress, not moving and really just feeling unwell, but nothing that really alerted me to anything, no pain. And then all of a sudden I was working from home. I laid down on the couch, got the urge to poop, and then went to go, had a bowel movement, and my pelvis started hurting. So I didn't think it was going to be a perforation because it was actually in my pelvic area, whereas before it was all abdominal lower back pain. That was what sent me to the hospitals for the bowel obstruction, the other perforation. And so the pain started to get very, not that it was very uncomfortable, but it was new pain and it was strong. And I wasn't worried, but I knew that this was different. I had something about it. I was just like, this is different. So I started packing a bag. So I was like, I should go to the emergency room to get this pain looked at. Still thinking it's going to be like, an ovary or something, like, I didn't think it was going to be anything crazy. And I ended up driving myself to the emergency room. I called my mom, like, don't worry, I'm just going to the ER to get checked out and I'll be fine. And once I got to the emergency room, the pain started getting so severe that I was in tears. And I went into the emergency room, and it's honestly kind of a blur, but I know that they did the initial CT scan because they wanted to also check for a dissection. And it showed the free air that was in my belly because my intestine had perforated. So that's how it began, and what took me to the ER.
Yeah. So it sounds like things started kind of escalating after you got to the ER with the pain levels.
Yeah, really fast.
Yeah. So once they figured out that it was a bowel perforation, what happened?
So, with VEDS, surgeries are very risky, especially in a state of inflammation, which I was in severe inflammation because, there's things that in my belly that shouldn't be out there floating around. And so they wanted to wait and see if it would heal on its own and I could avoid surgery, which is what they did for the first time. So they treated me with pain meds, which that was a whole ordeal in itself because nothing would help the pain. Nothing would touch it, like not even fentanyl, not morphine. And I think it was Toradol and ketamine that finally helped because I was feral in the emergency room. But yeah, so they admitted me for observation and then, kept an eye on my vitals and everything, gave me antibiotics. But I think a day or two later is when I became septic and they had to rush me into emergency surgery to take care of the perforation.
How did that go?
So it was, I remember, again, because I was so like up on pain meds and everything, it was all a blur, but I remember that the nurse was in the room and they were like, are you okay? And I was like, yeah, I'm good. Smile, thumbs up. And as soon as he walked out the door, I looked at my mom and I was like, I don't feel good. And then it's TMI, but I vomited and had like diarrhea come out at the same time, like just projectile, I guess. And my mom even said that it looked like I was throwing up stool. Like she said it was dark and whatever. So she rushed out. She found a medical team that was in the hallway because she couldn't find the nurse. They came and they had to like put me upside down to make sure I was getting blood flow to my brain because my vitals were dropping. So I was actually looking at the emergency room note a few months ago and my blood pressure had dropped to like 70/40 at that time. And so that's when they decided to go and they rushed me into surgery. They were like, you're probably going to end up with a colostomy bag. And I was like, I don't care. I just need to feel better. I need to get out of this. And so they did the surgery. And I had a hard time. So they were able to place a colostomy bag fine. The surgeon did tell us that this was one of the hardest, if not the hardest surgery he's ever performed. He said that everything was just so delicate, and he wasn't really sure what the outcome was going to be. Like it was very hard. And afterwards, they couldn't extubate me because every time that they would try to take me off of the vent, my vitals, I guess, would keep tanking or something. I don't really know what happened. So I was on the vent for another like 3 or 4 days following my first surgery.
So when you're on the vent, like you're sedated during that time,
I was sedated. Yeah, I do have some memory of opening my eyes and like I couldn't talk at all. But I remember I would ask, they had a pen and paper, so I would try to write things out. Like I would try to ask about my status. My mom had taken the first flight in like that she could. So she was there for me with me before I went into surgery. And then my dad and my sister were there. So I woke up to them there, and they were trying to help understand what the hell I was saying, like if I needed like a cold towel or something. And I looked back too, and we still have those notes, seeing how my handwriting was just like, I was basically writing without seeing. I was just moving my hand, thinking or hoping that I was writing the right words.
Oh my goodness.
But most of the time I was asleep while on the vent.
Yeah. So you were on the vent and you had a colostomy bag.
Yeah.
At that time. And then you mentioned a second surgery.
Yes. So they had moved me down out of ICU. I don't know if it was like their main like regular floor or a step down from ICU that I was in, but I was coughing a lot because, on top of this, I had pleural effusions in both lungs because of the colon perforation. So I had fluid in the membrane surrounding my lungs. So my lungs couldn't expand at all, really. And so I had a lot of coughing because of that. And then just natural coughing that comes after surgery from, any pulmonary buildup. And so we had asked for an abdominal binder, which is like this, I don't even know how to describe what it is. It has a Velcro strap and you wrap it around your belly, and that kind of helps hold things together.
So like a corset for your abdomen?
Yeah, kind of like that. But it's stretchy, so it doesn't like you could stretch it and then but it still feels nice and tight around. Like you can still breathe comfortably.
Oh, good.
With it.
Unlike a corset.
Exactly. And we had learned from my first abdominal surgeries with the bowel obstruction that helps. That helps keep everything together because with VEDS, we're at risk for wound dehiscence or our wounds splitting open. And they said I couldn't have a binder because of my colostomy bag. And I guess it would like interfere with the bag. But I was coughing a lot, and I was telling the nurses that it feels like my incision was splitting apart. And it's because they had to go in through my abdomen through the middle, right? That's how they placed the colostomy bag. So I was open in the middle, and that's where the incision was, just straight down my belly. And I was telling them I could feel it. It feels like it's splitting open when I cough. And they're like, it's okay. Like, hold this pillow. It'll help you with the pain, whatever. And there was one point where I did a really big cough and I felt it. I felt my abdomen tear open. And I think as a VEDS patient, we naturally assess ourselves, but also as a nurse, I was like feeling my abdomen, and I picked the binder up and I was looking underneath it, and it was soaked. It was like covered in blood and pus, I guess. I don't know. It was, and so we called for the nurses, and sure enough, when they took off the binder and they lifted the gauze pad that was covering me, like my intestine was literally showing because my abdomen just split open.
Oh my gosh.
So because of that, because my wound dehisced, they had to take me back into a second surgery to get my abdomen covered and my intestines covered. And in that surgery, it was the original surgeon who performed with the colostomy bag. But he was like, I had such a hard time that I'm calling in an abdominal wall specialist. So I had two surgeons working on me. And they ended up, when they, I guess, went back in to fix things, they noticed that there was this small tear on the outer lining of my small intestine, but they just left it because it wasn't going to cause any problems. And they weren't sure if they did it themselves or if it just happened from, the first surgery kind of trauma. So when they were going to try to put me back together, they ended up putting a mesh that covered the intestine and then pulled my abdominal wall back together. But they were saying that when they were trying to pull the skin back together, that muscle tissue was just crumbling in their hands. So they couldn't pull my muscle back together. So they decided to just leave me open, keep that mesh there, and then get a wound vac on. So then I had the colostomy bag, and then, which was like in the left side of my abdomen, and a big, like 8 centimeter long, maybe 6 centimeter wide hole in my abdomen where the wound vac went in to basically drain the wound and keep it, I guess, sterile, just, free from bacteria and stuff. So that was the second surgery, and I did better with the extubation then.
I feel like you went through so much during this time. Like I remember for part of it, I was in the hospital myself, but for another part of it, I was at home and you were still in the hospital. So how many surgeries in all did you end up having to have while you were in there?
So I was in the hospital for a total of 36 days, I think, 31 or 36, 34 maybe, in that range. And I had those 2 emergency abdominal surgeries within a week of each other, which is hard because they were both really major surgeries. And then I had, I think, a free week, I guess, if I remember. And then they had to treat the pleural effusions.
Yeah. Just the idea of this as a free week.
It was an awful free week.
Yeah.
I mean, I couldn't breathe this entire time because of the pleural effusion. So I had to sleep sitting up. My head was bobbing everywhere. Like, my parents had to buy me one of the airplane pillows because I couldn't lay back because I couldn't breathe. But then I also couldn't turn on my side because I had this colostomy bag and this wound vac, and I wasn't adjusted to them yet. And then my back was hurting a lot because I'm laying on my back for so long. And it was like a lot of little things that made it very hard. And even then, like, before I had my lungs drained, they would try to start me on feedings, right? On foods. So after the first surgery, I actually did have an appetite, and I was even like coffee smells so good, I'm ready to eat. But then after my second surgery, zero appetite. Like, I could not. They had me drink those Ensure shakes, and I could not drink those. Every time I would try, I would start throwing up. I just couldn't do it. And it got to a point where I even had to get evaluated by ENT and speech language pathology so they can see if there's anything wrong with like my swallowing or anything. And on top of that all, because of the intubation, I couldn't speak. Like, I had to also get evaluated. They had to put a scope down to look at my vocal cords. And one of my vocal cords was damaged from the intubation. So that was all going on in my free week.
Right.
And then, and I was swollen. I don't know what it was that caused it, but I was swollen everywhere. They had to give me diuretics to keep getting fluid out of my body. Like, my arms and legs were huge. And so, like, there was that on top of everything else. But so the next week I had to get thoracentesis on each lung. So they did one on the right lung, like on a Wednesday, and the left lung on a Friday. And I was really scared for those. I mean, I wasn't strong, but I was starting to kind of come back more to like my body and things. And so I'm like, okay, I actually have time to think about this procedure. But what they do is they stick a big needle in your back to the spot that needs to be drained, and then they drain the fluid. And so the first lung that they did, it got close to a liter of fluid out. It was like 900 mLs or something, or 800. And then the second time, the other lung, they did 800. So I was able to breathe better. I was able to lay down a little bit, still not as well after both of those, but it did make a big difference. Like, even when I would talk and stuff, you could tell how my breathing had improved. And on top of that, too, I would have respiratory therapy come in and give me albuterol treatments and stuff to help with my breathing. So my lungs had it pretty bad also with everything. But and not being able to breathe is so scary. I remember they took me down for a CT scan, and I had to be completely flat on the hard bed. And I wasn't even sure that I'd be able to handle it because I couldn't breathe. at all.
Yeah, that sounds so
Um,
scary.
yeah. And then I just realized I got a little bit, I'm so on topic, but a little bit off. But I had one more procedure after all of that. And that was for my open wound. The surgeon, they contemplated doing a skin graft, but he was like, with your skin problems, with your fragility, like it's probably not, we don't know if it's going to be helpful, probably not helpful. And so he's like, there's been new research on fish skin. And so what they did was they took me down into the OR for this, and they put fish skin all around the edges of my wound to help it heal. So he's like, this is in place of a skin graft. And he said that when he was also doing that, he looked inside the wound and he noticed some pockets of tunneling within the wound. So like if you look down into the wound, there were little like craters or tunnels being formed outside internally, which is not good. So he was able to correct those, and he said those would have caused problems had they not fixed them. So
Are those essentially like fistulas? Like
maybe
okay.
because they were like openings, but they weren't connected to like other organs or anything.
Got it.
But it might have just been like a opening through the wound into the abdominal cavity.
Yeah.
Maybe. Right? I don't know. So they did that, and that was the last procedure. That one was the easiest procedure, but it was still a bit to recover from. And then I was discharged, I think, a week and a half after that.
So this might be an emotional question, but you were in the hospital for over a month.
Yeah.
Right? And I feel like the trajectory of this bowel perforation for you was looking pretty bad for a hot minute there.
Yeah.
And if you don't want to answer this, that's totally okay. Was there any point while you were in the hospital that you felt like you lost hope? And if so, like, how did you get that back?
Yes. So I'll be honest, I was just so sick that I could not even think about my feelings or process my feelings. It wasn't until the following month that all that hit me, which we could go into because I did get hospitalized again after this. But I was just so sick and so like just on the edge that I really couldn't process any of that. Like even when I was told that I was going home, I wanted to stay in the hospital because I was not sure how I was going to be like at home or, how my body was going to act. And so, I honestly like could not even, I was sleeping so much just because my body was going through so much, did not process anything.
Yeah. So tell me about when it hit you then.
Okay. So it did hit me a little bit a couple weeks after I was home because I was discharged on December 13th and it was really sorry.
No, it's okay. Take a breath. Take as much time as you need. I remember calling you, and I don't remember when it was. I think Fran called me, and I was home, and I think I was feeling a similar feeling to what you probably felt like a couple weeks later. And I was just so like, it was so good to see you in that moment because we had both been through this like really traumatic thing. And on the same day that my event happened, we were together on a live stream. And then like 3 days after my event, you went in. And just being able to see you like after I got home and I was feeling all of that despair. And then finally being able to see you and talk to you for like less than a minute, I think. I think we were just crying on the phone together. And that's why I asked this is because I think that this is probably a feeling that a lot of us feel after these events. And I don't know if we talk about it enough on how to get back from that, So like take whatever time you need. Like I know for me it was a big dark feeling, and
It is. I mean, especially once you're home from the hospital, you still have to recover. So like not only are you undergoing the physical recovery, but you actually are starting to kind of come back into your mind from everything. And then it's starting to hit you like, oh my God, I just went through all of this. And like you really are uncertain of like, is it going to come back? Or am I like, when is this tunnel going to end, you know? And it was especially hard because I was home around the holidays, and it's better to be home than in the hospital. But it was really hard on me because it was the first year that I could not go back to my hometown and spend Christmas with my family. I luckily had my parents here in the city with me, but it's really hard because, you know, I missed out on little things like that. And it just like sucks after everything that I went through. I don't get to be with my loved ones. And I will say that having support, though, helped me so much. Like, having my friends check up on me, my VEDS friends, like, we're all so gracious. And just my parents being here really, really helped me push through. Like, I remember anxiety would hit me a lot at night. Like, I had to, this was after my second hospitalization when I get there. But my mom would just rub my back and it would help me feel better. And I mean, it was hard here at home because I think, was I using the bedside commode? I don't know if I was still using the bedside commode, but like I still had to sleep with my head elevated here at home. Like I still had to have my mom help me get up from the bed, and it's a lot to process.
Yeah, for sure. And that feeling of like you mentioned, like, is this going to happen again? Like, when is this tunnel going to be over? So you did end up having to go back to the hospital.
Yes. And so this one is like, it's also related to our stupid intestines. It was a week. So it was literally a month after I was sent home, you know, from the whole perforation and everything. And I was seeing my surgeon every 2 weeks because he was changing out my wound vac dressing and taking a look at the wound just to make sure that everything was healing fine, keeping an eye on my colostomy. And so the colostomy is from the large intestine. So it's, you know, actually formed stool and stuff as if it would come out of your butt, but it's going into a bag for me. And so literally like on a Wednesday, I got my wound dressing changed, and then everything looked good. And Thursday morning, I woke up at 5 a.m. And again, I have that habit of assessing myself and checking that things are all in order. I put my hand on my abdomen and my belly was wet. It was soaked. And I was like, what the hell am I touching? Because I don't know what this is. What could it be? And I had no pain. And the day before, when they did the wound vac dressing change, they also put more fish skin in. So I yelled for my parents because I was like, I don't want to move. I'm just holding my hands in the air, like frozen. And we couldn't figure out what it was. So my wound vac was getting full because whatever it was that was leaking was going into the wound vac, but it was leaking so much that it was also coming out of my wound dressing. And if you know about wound vacs, the dressings are on pretty tight. Like they're supposed to be air proof and everything. So for something to be leaking out of there, like it has to be a lot. So I would stand up and then liquid would just fall like to the floor.
Oh my goodness.
And we just could not like control what was going on. We had no idea what it was. I was like, maybe it's just the fish skin, like a reaction or something, you know? So we go to the clinic again, and the resident there, the intern, was it the intern? It was the higher resident, I think. He was like the fellow. It was a fellow. He was trying to patch it up, get it dry, because we couldn't even get new adhesives to stick because it was leaking so much. And again, it's the center of my abdomen, so the colostomy was fine. It was all like at the incision site. And so he took a look at it deeper, and he saw a little fistula there, a little tiny one. And so what a fistula is first of all, we're at high risk for developing them with VEDS, but it's a definition is an abnormal opening between two, you know, like channels or two organs. And so what happened was that my small intestine adhered itself to my wound. So flat in the middle of the wound, my small intestine created a little opening, and liquid from the small intestine was pouring out through my wound into the wound vac and just coming out. And since it's a small intestine, it's all liquidy, right? It hasn't become formed stool yet. So he was like, okay, you just got to go to the emergency room so that way they can we can get you started on antibiotics for this, and we can get a CT scan and just get it confirmed that it's a fistula. So it was like as soon as I would drink the oral contrast for this, it would come right out of the fistula. And I had those like abdominal pads, or what are they called when they put them under your butt in the hospital beds? I forgot. The chucks. Those pads that they put under your butt in the beds? I had like loads and loads of those that were just immediately getting soaked, and nobody in the emergency room, like they're not wound care people. So I was just sitting like with this all over my abdomen all day. My abdomen got so irritated, like the skin around it. It was like red, it was raw, it was itchy, until finally they were able to get somebody, I don't even remember. I know my surgeon came in late at night to attempt to help put something on to cover it and capture the liquid that was coming out. But yeah, I was admitted so we can figure out how to treat this fistula. And so they had me NPO with IV nutrition for this. So the NPO means like I couldn't eat or drink anything by mouth and had to get all my nutrition through the IV for this. So that was the second hospitalization.
Oh my gosh. How long did that last?
That one, I remember I went in like on a Thursday and I was at home maybe like on Sunday or Monday. So it was like 5 days.
Okay.
But I was sent home again, NPO and with the IV nutrition. And I just remember all that weekend or those few days that I was at home, I wasn't feeling good because I wasn't eating. And the IV nutrition, I don't think it was enough to sustain me because like my mouth was so dry. I was just feeling so awful. Like I was even asking my mom to let me have some sips of Gatorade just to get some hydration in. And she did. She gave me some. And then I think towards the end of like those few days, my colostomy bag started putting out like black stool. And so I was also on an iron supplement because I had to have a lot of blood transfusions from the first hospitalization. And so I still it took me a long time to get my iron levels back up. So I was taking iron supplements. I'm like, well, it could be dark from the iron, who knows if this is a bleed or not. And so because of that is when we called my surgeon and he was like, well, just come to the emergency room. We'll check it out to make sure it's not a bleed. And so I went in and they admitted me again. So it's all related to the fistula, right? Fistula, colostomy intestines. I didn't have pain either of these times, which was good. It was more just trying to figure out how to treat fistula and kind of get a routine going for me. They didn't want to send me back home without knowing that if I was gonna come back again for like nutrition, hydration, right? So they wanted to keep me there until they found a good routine that worked for my intestine and for me. So this time around, they ended up giving me a medicine that decreases the secretions that the intestines make. And so they were giving that to me routinely throughout the hospitalization. And then they said I could try food this time. And so that, and then plus taking fiber supplements like Metamucil 3 times a day is actually what worked best for me. So I was in the hospital for maybe like a week or 9 days that third time because they really just wanted to make sure that I was good before I was home again, But yeah, that is, the anxiety was really bad, the second and third hospitalizations, because when I went back the second time, I cried because I was not ready to be back there again. And then even the third time, I did have to ask for a therapist and psychiatry to come see me during the hospital stay and give me stuff for anxiety because it was bad.
Yeah. And that is, there's a number of services at a hospital that you can ask for like that. Like there's you can do therapy there, right? And see psychiatry. And then there's also spiritual services for anybody listening that doesn't know that those are available to you when you're in the hospital. Like those should be made available to you, right?
Yeah. And I don't remember if they offered it to me or if I asked, but it was very helpful because they did prescribe medicine for my anxiety. And then the therapist that I talked with, like, she was just giving me ideas for how to handle and manage my anxiety, which I think is a good thing to share because people might benefit from it. But she did suggest having like an anxiety box, and this could be a physical box or a mental box. But in this box, you're going to put your tools that help you manage, stress, things that bring you comfort. So like if you had a physical box, you put your favorite blanket in there, put a coloring book in there if you like to color, and then that way, in times of anxiety, you don't have to think like, oh, what's going to help me? You could just go to your little box and grab something out of there that will help you relax. And that was something that was super big for me because it is hard, like, to think when you're going through anxiety, right? Like, you're not really, your brain's not thinking right because it's focused and alerted by other things. So that helped me big time also. That and the Switch got me through.
Your Nintendo Switch.
Yes.
Bella is a gamer, and do you want to plug your gaming channel? You can if you want to.
I will say I have two personalities. So I'm a plug-in VEDS-tigator because that is professional VEDS, and Bumblebells is not as professional, but it's fun gaming. So Twitch, Instagram for Bumblebells, BELLES. But I like to stream my gameplay and hang out with people. So
that's awesome. So that helped you in the hospitalization. How many hospitalizations did you have total? Was that the last one?
That was the last one. So that was 3 hospitalizations from November. It was November 6th that I went in until like February 9th or something, because then I was home from the 3rd hospitalization.
Yeah.
It was a long 3 months or 4.
Oh, yeah. Yeah. And then still, like, you still have the colostomy bag now.
Yeah.
So how has it been since February when you were discharged for the last time?
Yeah, so it's been huge. It's been so different, honestly. Like, so I have 2 bags. I have the colostomy bag, which is the one that's supposed to be there, and then I have a fistula bag to collect the output that's coming from that fistula, the small intestine. The fistula is supposed to close on its own, or it can, but it hasn't. But the output from that has significantly decreased. Like I was telling you, it's putting out like a liter of fluid every day. And now it's putting out maybe like 20 milliliters every other day or so. It's super, super manageable now. And having the fistula made me appreciate the colostomy more, to be quite honest. Like the colostomy, it was just so much easier to handle compared to the fistula. Like I remember one time my mom and I, because she was helping me a lot, right? Like obviously I'm home from the hospitals. I'm not in the headspace to learn how to do these bag changes, how to take care of the fistula, the ostomy. And so my mom was helping me change out the fistula bag, or it was leaking after the shower or something. And so she was like, what if we try sitting down instead of laying down to get a good fit of the bag on the skin? And the fistula literally squirted out. It just squirted like and my mom's laughing because she was like, it's like when you're changing a little boy baby's diaper and the pee just squirts out. Like that's how my fistula was acting. It was a mess. It was so horrible getting used to that damn thing. So the colostomy was just way easier. But yeah, honestly, now I feel so much better with the bags on. I don't even notice that they're there really. Like I'll just walk around with them hanging out. I'm comfortable with them. They're actually not as bad to manage as I thought they would be. Because one thing that put me off to them was the management. Like I am not a maintenance kind of girl. If I have to do something every day for something, I will not take care of it or do it. And I kind of like prep. It's like having your own little diaper bag and your own little, thing to take care of. Mm-hmm. So I enjoy actually changing the bags now. I think it's a little bit therapeutic. Even the wound care nurses, when they were trying to teach us for the fistula, they were like, it's like an arts and crafts project. Like you just literally have to cut things and figure out what works best for your, the ostomy or the fistula. So, bags, honestly, I do need another surgery because I have that hernia where there's no abdominal wall muscle where the mesh is covering. So my surgeon wants to go back and close that, take care of the fistula. But we decided that I'm going to wait a little bit because I'm not ready emotionally. And so he said it's okay. We could do that. My hernia is not growing. He said if it was growing, then he wants to act on it. But yeah, so he's still following me. I went from going to see him every 2 weeks to now like every 3 to 6 months. So that's nice.
Nice.
I did do cardiac rehab, which I think is a really, really important service that people should know about too. Especially coming from a bowel surgery to cardiac rehab, people would be like, why? And even I was like that. When I was going to start cardiac rehab, I told my mom, like, I'm just going to cancel it. I'm feeling better. I'm feeling stronger. And my mom's like, just go and see what it's like. And you don't have to go back. So I was like, okay. And I loved it. Like, it was really, really nice how cautious they were and how individualized they are to help you get your strength back and your stamina. And so it's like physical therapy, but for the whole body, and really just getting you like back to moving again. Mm-hmm. And it was such a nice service. I finished that in August. I think that played a big part in my recovery mentally as well. And they did focus on nutrition and mental health too. So
that's awesome.
Yes. So doing a lot better with all of that, feeling good, traveling, back to my hometown and stuff.
Speaking of traveling back to your hometown, I saw the video on Facebook. I think it was on your Investigator channel.
Which video?
The one where you surprised your family.
Oh, you want to talk about that? That was so fun. Yeah. So I had been trying to go back to El Paso. I actually had a flight scheduled back to my hometown in January. Literally, the day my fistula formed and I had to go to the hospital, I was supposed to fly back home 2 days after. So I couldn't go back home, right? And I was already sad because I missed the holidays. And so there was never I didn't want to travel with the fistula either, just because it was leaking all the time. It was just high maintenance. It was just too much for me to have to think about getting on a plane and sitting with that. So in April, which was it was 2 months after my fistula, 3 months after it formed, but 2 months after my last hospitalization, where it was like in a much better regimen. My mom was going back to our hometown for good, because we both felt that I was at a point where I can manage myself again. And she was with me for 6 months, literally. Like, she stayed taking care of me for 6 months. So anyways, my family knew my mom was going back. They're expecting her, and we decided to surprise them all by me going back with her. So even my dad, who picked us up at the airport, was only expecting my mom. And I have a whole compilation of videos of me surprising my siblings, my dad, my niece and nephews, my cousins, my best friends. And it's so I love watching it. Like, it was just very emotional because, like you said, a lot of people did not know what was going to happen to me. And, my brother hadn't seen me since after my second surgery. My sister hadn't seen me since New Year's. And so they all had last seen me when I was in a very delicate state, or had not seen me after hearing all of this. So for them to see me with their own eyes, I think it was something healing for both me and for everybody. And that, like, after that trip, I actually was just a lot better overall, physically, mentally, emotionally too.
Yeah. Yeah. Is that when you started feeling more, I want to say normal again, right? Like,
yeah.
Yeah.
Yeah. I always say that that's when I started to see the light at the end of the tunnel, was at that point.
Yeah.
And that was in April. So that was about 5 to 6 months after my colon perforated.
Yeah. That healing time is no joke.
It's not.
Yeah. And are you planning to have a reversal for your colostomy?
I'm still undecided. So if they're going to go back and do a surgery to fix the hernia, I'm kind of like, well, might as well do a reversal if you're going to already be there, right? But at the same time, I'm pretty comfortable with the colostomy bag. I have no problems with it, aside from, like, I don't know how to dress. Like, I can't wear jeans because it's so low on my abdomen. I wear a lot of, like, dresses and loose pants right now, which is fine, and we love being comfortable. But I just can't. I'm so traumatized by all the complications that I had. I can't picture myself wanting to decide that.
Yeah. Totally reasonable, by the way. Yeah. If you need anybody to tell you that that's totally reasonable to have that anxiety.
I just, do not want to think about it at all.
Yeah. So as of right now, your lungs are better?
Yes. So I actually had to have another thoracentesis in March. So that I didn't have to go inpatient for that or anything, but I did. I was still having shortness of breath and cardiac rehab. And my pulmonologist ordered a CT scan and it showed that I still had a moderate pleural effusion on my right lung. So I did have to get that drained, and they drained about 700 milliliters from there. And that was the last that my lungs have had to be touched so far. I had pulmonary function tests that they're not as good as my baseline was, but way better than in January. I don't have shortness of breath or anything, so
that's great.
Hopefully that's the last of those procedures.
I hope so. You went through so much.
Yeah.
After this experience, is there anything that you would want either people with VEDS or any of the connective tissue conditions that have to potentially go through something like this, whether it's a major aortic surgery or an aortic dissection or a bowel perforation like you had, any kind of major thing like you went through, is there anything that you would tell them as far as advice for getting through that?
Yeah. So for hospital stays, I will say to use all the services that you can. So like, physical therapy, the therapist, all of that is very helpful in the recovery. As much as it sucks, I hate it. Oh my God, you should have seen me when occupational therapy would try to come get me up during my fistula hospitalizations. And it's because they would come in the morning, right after I changed the bag. I didn't want it to leak, or just at horrible times. And I was just but that is such a pivotal part in the recovery, is to be moving, but also listen to your body, right? So that would be one piece of advice. And then also to if they have samples or supplies to give you, stock up on those in the hospital. We did not have to order any colostomy supplies until maybe February.
Oh, wow.
Because we had so many samples that we got from all 3 of my hospitalizations. They would just bring them up to us. So that's one thing for sure. And then I know it's hard to ask for support, and if you don't already have a support system in place, it's easier said than done, but having your support system, just having a network of people that know what's going on with you so they can check in on you, just knowing that you have that to fall back on is helpful, even if you don't use it. You know what I mean?
Yeah.
Just knowing that there's an army of people that are ready to catch you is something that is super helpful and comforting to get through. And also another thing that helped me get through it was thinking about other people's experiences. All I could think about was one of our VEDS friends that's also local here, who went through a similar thing last year. And she's 10 years younger than me. And all I kept thinking was, if she could get through this, I could get through this.
Mm-hmm.
She did this, I could do this. And so a lot of that has support, comes from connecting with others. So it helps to be involved with your community of related disorders.
I think that's such good advice right there. Just I talked to somebody today who has 7 aneurysms, and that's one of the things that I am dealing with, right? And it was okay, somebody else is dealing with 7 aneurysms. I can do it. Yeah. I feel a little better knowing that somebody else is out there living with so many, and that they are able to move through their life and, find happiness and joy and be able to put those in the back of their mind and enjoy what's important to them. And that has been something I've been working on. And I think it is, as you mentioned, it's part of that community engagement and connection piece of sometimes it can really suck when you see bad things happen to people, but then it also gives you a frame of reference for what you can survive.
Exactly. I'm all these younger ones, if they could do it, then why can't I, So that was a big piece in helping me push forward. And again, just having my mom, my angel, there with me all the time. And my dad too, of course. Just my family support means everything to me.
Mm-hmm. Do you have anything you want medical professionals to take away from this episode?
Yes. Loud yes. My big 2 words, my big 1 word is listen. it was so interesting to me to see the difference in the medical professionals that were taking care of me since the beginning of my colon perforation and the ones coming in later on in the stage that I was at. Like, you could just see it on the faces of those ones there from the beginning. Like, they were worried. They genuinely cared. They saw how much I went through. They realized how fragile my body is. Whereas people that came on later, they could not grasp the seriousness or severity of everything that I went through. It's not their fault, because sometimes you do have to see it with your own eyes, but it would be helpful to just take in what the patient's feeling, their own experiences. I think that one of the more negative interactions that I had was with somebody that came on later on, where I was coughing. I even had a red eye, like my eye was bleeding, it was bruised, and I was hearing a whooshing sound in my ear on the same side that my eye was bruised. And I had asked them for a head CT. I was like, I've been coughing a lot. Who knows, what? And he was like, oh, I don't think you need that. And I was like, well, I've been coughing a lot. I have this pain, like obvious, more than just one symptom. And he was like, I really don't think it's going to find anything. And so that's when I got my vascular surgeon looped in, and they went ahead and they ordered the CT scan. So things like that, where if it was somebody, the residents who were on my team from day one, they would have been like, yes. Like, they would even call me their best friend and stuff. Like, we're besties, and or find things to relate to your patients about too. It was helpful to talk to them about like Taylor Swift. I had so much fun talking to all my team nurses and everything about Taylor Swift. So just all the little things matter, I had a nurse that offered to shave my legs because, girl, they got hairy in a month, no shave. Yeah. And then I had another medical student that would like just rub my hand, and that would make me feel better.
Oh, yeah.
So my big takeaways always from medical professionals are always listen, even take the time up to look VEDS up. There was one of the fellows, she came back in, she was like, I looked up VEDS, and she's like, and I don't remember exactly what she said, but it was along the lines of like, she looked it up and she understood the complexity of VEDS, and it just makes sense of everything that I've been through. And like, it really, maybe she thought she knew what VEDS was, but not until she went back and looked it up, where she was just like, oh my God, like, yeah, this is serious. This is big, even though she had already seen everything that I went through. But it meant a lot to me that she looked it up.
Yeah, for sure. I think that's great. That's a great takeaway for the medical professionals listening, is like, we hear this all the time from people. They're like, like, I don't know, in the number of interviews that I've done with people, that is one of the number one, if not, I would guess the number one thing that people say is, listen to us, listen to our symptoms, listen to what we're telling you about our history, listen to us telling you that VEDS is different and that this is a big, big deal. And that pain in your abdomen, you're feeling it splitting, like you're not hallucinating, like that's the real feeling, right? I hear that over and over again from people, and I really, really hope that the number of episodes of us saying this, like, really, really gets through, because it's scary enough going through something like you went through, and to have the added burden of trying to make sure that you're being taken seriously, that you are not, like, you're almost taking on that burden of needing to make sure that you don't die there, that there's something is not ignored that is so severe that you die there in that hospital where you should be taken care of. And that's not a burden that we should really have to carry. But I think so many of us do carry that burden when we're in the hospital. Yeah. And listening can make such a big difference.
It does. And just like I said, paying attention to your patient. And like, another story I want to share is with my surgeon during one of the fistula stays. He came to talk to me in the morning, and I was yawning away. I was like so tired. And the stupid like medication scheduling was like, they gave me a sleeping pill at 10 at night, but still came to me at midnight to give me more meds. So I would be like asleep, and then they wake me up and to do that and take vitals. And so he, on his own, he advocated to my whole nursing staff to not bother me between the hours of 12 and 6. Like, he authorized them to skip a vital check. That way I can have like a restful night's sleep, because it was important to him that I got restful sleep. And that is something that a lot of providers don't get either. But he learned that during the care with me, right? He learned that I needed to get adequate sleep in order to help my recovery. And it was his idea. Like, they put a sign on the door and everything. Like, I think they thought that my mom and I were being pretentious. Like, please do not disturb us. But it was all my doctor, you know?
Yeah.
So that was super helpful. Like, just those little things, paying attention, you know?
Yeah.
I wish that should be the standard and not these exceptions.
Yes. Yeah, absolutely. Thank you so much for coming back on and sharing your experience with us. I know that reliving it can't be easy, and I know that
I think my mind buried it.
Yeah. I really, really appreciate you coming back on to share.
Thank you.
Is there anything else that you wanted to share that before we end?
I will say that I strongly believe that stress played a big factor in what happened to me. I don't think it's the only thing, right? I think I was already probably going down this path, but a period of high stress made it come faster. So I just, if you guys can, you know, I know that it's not easy, not everybody can do it, but just take the time to rest. Try to keep stress levels down. Like, it is so important for our bodies to recover and to rebuild, and we don't bounce back like other people do. And I think that if you just keep going and going and going, we're like vehicles, right? We're going to have wear and tear, and it's hard for us to bounce back. So take care of yourselves.
Yeah.
Not that I wasn't, right? But really like listen to your body. Number one, listen, doctors, and then patients, listen to your body.
Thank you again so much for coming on and sharing your story, and for the advice that you gave as well.
Thank you for doing this. I know that the reach has continued to grow, and I'm really excited to, you know, see this work that you're doing and the effort that you're putting into sharing all of our stories. Like, you don't know how much all of us, and I can speak for all of us, because I know I just hear it from everybody that I've talked to that's been on the show, or that, you know, listen to your stuff, that they're appreciative of the work that you do.
Thanks, Bella. I love you, girl.
Thank you. Love you.
Thanks for listening to this episode featuring Bella Marin sharing her experiences with VEDS and a recent bowel perforation. If you're ready to meet others, get involved, or need support, there are links for you in the episode show notes, as well as information on research studies for people with VEDS, Marfan, and Loeys-Dietz, including those of the VUS. If you like this show, be sure to share it on social media or give it a rating or a review. You can also support the production of this podcast by joining my Patreon, making a one-time donation, or by buying merch. As always, my top tier patrons are listed in the episode show notes. In the next episode, we'll talk with Carmen David about her experience with an aortic dissection and a VUS. See you soon.